So you've just been informed that you must have a C-section and you're scared. In today's video, we'll discuss what you can expect during your C-section. Hey guys, welcome back. My name is Dr. Bobby. I am a board certified anesthesiologist, and listen, you already know on this channel, we talk about all things education, motivation, and personal finance delivered to you in an easily understandable and relatable fashion. If you like what you see and you find value in our content, please feel free to like, share, and subscribe to the channel. Now listen, I have been a practicing anesthesiologist for the past 7 years, and I gotta tell you, I have come into contact with so many first-time moms who are otherwise terrified with the possibility of potentially having a C-section or really just the act of having a baby. In today's video, we are going to get into all things that you can expect during your C-section. Now, for the purposes of this video, we're gonna sort of stick with the script that you are an otherwise healthy female who has an unremarkable pregnancy and are scheduled to have a C-section. I'll cover emergencies in a different video. Now, before we get down to the nitty-gritty, I'll say that, I don't represent every anesthesiologist, nor am I practicing in every state in the United States. But what I will say is that for the most part, us anesthesiologists are pretty much alike, and we do most things pretty much the same. So if you find yourself in a United States-based hospital, things will primarily go this way. Now, before we start talking about exactly what to expect, we should probably first define exactly what a C-section is. Now, C-section stands for cesarean section. A cesarean section is essentially a surgical procedure used to remove a baby from the abdomen as opposed through the vaginal canal. Now, there are many reasons why obstetricians may decide to deliver a baby this way, but for the purposes of this video, we won't go in depth about the indications and contraindications of actually having a C-section. Let's just sort of stick with the script that your obstetrician has already told you that you have to schedule a C-section. Now, once you've reached full-term gestation, your obstetrician will decide exactly a particular date for you to be scheduled to have your cesarean. It's super important for you to adhere to all the fasting recommendations that are given to you preoperatively. Under normal circumstances, you'll be instructed not to eat anything after midnight. Once you show up to the labor and delivery unit, you'll be admitted, and the anesthesiologist taking care of you will be notified. Now, typically before calling the anesthesiologist, the nurses taking care of you will have done a few things. Under normal circumstances, they will have placed an IV line and started hydration. This hydration is of extreme importance for you because these procedures can result in a lower blood pressure. Therefore, we try to give you enough fluid so that we can offset the potential lowering of your blood pressure as a result of the procedure. So once you have an IV line, once you've received some hydration, at this point your anesthesiologist will probably come to find you. Once your anesthesiologist arrives, they'll probably start doing what we call a history and physical examination. Basically, in layman's terms, a history and physical examination is information regarding your pregnancy, your past medical history, your medications, allergies, etc., in order to get an idea as to how sick you are or what type of risks are involved for you, particularly in doing your procedure. Make certain that you adhere to the fasting recommendations because the anesthesiologist will ask you when the last time you ate. You need to have not eaten in at least 8 hours. After getting an appropriate history and physical examination, the anesthesiologist taking care of you will begin what we call the informed consenting process. They will typically go over exactly what you can expect when you hit the door and you get into the room for the C-section. Once they've explained all of the risks and benefits of the procedure to you, they'll get your written permission to proceed. Now that you've signed everything and given your permission, it's time to get down to the nitty-gritty. A nurse will typically walk you to the operating room and have you sit up onto the operating room table as if you were sitting on a park bench. Now, depending on the anesthesiology staff and the policies at your hospital, you'll either have what we call a spinal anesthetic or a combined spinal epidural anesthetic. In layman's terms, you're going to be numb up to your breasts. Sometimes we leave an epidural catheter in the epidural portion of this in order to help with pain after the procedure. So once you're sitting up on the bed, you're probably going to be pretty nervous. Take a deep breath. We're going to hold hands and we're going to jump the ditch together. The first thing your anesthesiologist is going to do is probably put on some oxygen and then attach the monitors that are used to keep you safe. Typically, in this case, we will normally attach the blood pressure cuff and the pulse oximeter. You'll feel your anesthesiologist touch your back, clean your back off, and set up a sterile field with a drape. Next comes the big pinch. Essentially what that means is we give what we call lidocaine or numbing medicine to numb the skin so that you actually don't feel the spinal. Typically you feel that discomfort with the numbing medicine for about 5 seconds. Once your skin is numb, we then proceed to start the spinal anesthetic. Normally, most patients represent this as kind of like a pressure sensation. Before I go any further, I should probably give a brief explanation as to exactly what a spinal is and how it differs from an epidural. Spinal anesthetic is essentially pricking the small dural sac where the cerebral spinal fluid is bathing the spinal nerves. We inject a small amount of local anesthesia there, and it causes immediate numbness. That numbness then travels up to your chest, and then you remain happy during the C-section. That differs from an epidural, which is a catheter that sits outside of the dural sac. Small difference, same result. You'll be numb. So once the anesthesiologist injects the spinal dose of local anesthesia, you will notice immediately some sensation changes. Your butt and legs will become warm, and progressively you won't be able to feel or move them. That numbness will then travel up to your breasts, and you will be numb from your breasts down. After the spinal dose of medication is in, you're laid down in what we call the left uterine displacement position. This is used in order to decrease the likelihood that your baby will sit right on top of you and not get enough blood flow. In layman's terms, you're just tilted to the side. So now the hard part for you is done. You won't feel anything after this. So as you're laying down, a bunch of things will happen. This will seem sort of like a pit crew. The anesthesiologist who's taking care of you will probably start to check in with you and ask you how you feel. You may also notice the anesthesiologist taking care of you looking at the screen a lot. The reasoning for this is because after a spinal anesthetic, you can have a lower blood pressure. This lower blood pressure can be manifested as nausea. Now, you can get nausea from this experience despite having normal blood pressure, but we like to make sure that your blood pressure is normal, not just because of the nausea, but also because your baby doesn't like lower blood pressure. So more than likely, you'll see your anesthesiologist also giving you oxygen, also increasing the fluids, and possibly giving you medications to maintain your blood pressure during this time. Now, meanwhile, you have the anesthesiologist doing all this stuff. You got room nurses who are also sterilizing your belly and prepping you to have the operation. Now, at this point, it's important for me to explain a couple of things, especially in regards to the way you're going to feel at this time. With a spinal anesthetic, you will feel people touch your body, but you will not feel any pain associated with the things that would otherwise cause pain, like cutting your abdomen open. In addition to the touch you may feel, you might also feel tremendous pressure at times. Namely, you'll feel lots of pressure when the obstetrician is maneuvering to deliver the baby. Additionally, during the repair of the uterine incision, you may feel things like chest pain. You're not having a heart attack more than likely. It's just referred pain because of what they're doing. Again, it's also pretty common for you to become nauseous during this experience as well. So if you experience any of these things, understand that they're unfortunately par for the course. So at this point, the spinal anesthetic has had plenty of time to set, your belly has been appropriately sterilized, and you're in a good way. Now it's time for the surgery to get started. The first thing that happens is your obstetrician and the assistants put up a blue drape. Once the blue drape's up, there's no turning back. You're going to have this baby. Now, prior to actually starting this operation, I'm sure you're completely teeming with anxiety and worried that you're going to feel something that you aren't supposed to feel. Don't worry. Before we start anything, the obstetrician ensures that you don't feel anything. Once we perform a test to ensure that you don't feel anything, whomever you've decided to come in the operating room with you, whether that be your husband, your boyfriend, or your significant other, can come right on in. Now, this is the important part. Tell the person who's with you to distract you, and also tell them to bring their cell phone because you want to capture the memories, right? Now, under normal circumstances, when you start a cesarean, it doesn't take a very long time to get to the baby, assuming you haven't had abdominal surgeries before and you haven't had a C-section before. You'll know you're getting close to the time of delivery when you hear these words: uterine incision. This means that the obstetrician is going to incise the uterus and deliver the baby. This is when you'll feel the most pressure. So as the baby's being delivered, you may feel as though an elephant sitting on top of your chest. This is because of the maneuvers that are necessary for the obstetrician to remove the baby from your uterus. And just like that, life happens. Your life's changed. The baby's here. Sometimes the babies cry, sometimes they don't. But either way, the baby will be handed off to a group of pediatricians and nurses that will be there specifically to ensure that the baby is safe. Under normal circumstances, this is done with an eye shot of mom. Under normal circumstances, if the baby's doing okay after the initial assessments, they will wrap the baby up and bring the baby over to you so you can inspect your new bundle of joy. But we're not done yet. Your uterus and your skin still needs to be closed. So while all of these other things are happening, your obstetrician and their assistants are taking care of that. In addition, your anesthesiologist is doing a bunch of things as well. Once your baby is delivered, you have to receive a medication called oxytocin. Oxytocin is what we call a uterotonic. In layman's terms, it's a medication used to make your uterus go back to normal. The reason why this is important for you is because a floppy uterus is dangerous. A floppy uterus can bleed. No one wants the bleeding. You don't want the bleeding. We don't want the bleeding. In addition to this medication, typically if you're nauseous or you're having discomfort, the anesthesiologist will also administer pain medication and or anti-nausea medication. Now, under normal circumstances, it can take a little bit longer to make the repair of the uterus and the skin relative to the amount of time it takes to actually get to the baby. So don't be alarmed if it takes a little bit longer to close things up than it did to actually deliver the baby. But the good news is at this point, you're going to be distracted by your new bundle of joy. Now, assuming everything goes well with your repair, you've made it. After the obstetrician and their assistants are done with your uterus and your skin repair, you are then disconnected from all the monitors and shifted onto a bed for recovery. The final thing typically done by most obstetricians is something called a fundal height check. Again, we talked about the fact that you get medications to make your uterus clamp down in order to decrease the risk of bleeding. Your obstetrician wants to ensure that your uterus is moving downward in your pelvic area in the appropriate fashion. So they palpate your uterus through your abdomen. Initially, you won't feel this, but unfortunately, the nurses taking care of you in recovery will have to continue to do these fundal height checks in the recovery area as the numbness wears off, and you probably won't be that happy with this. Now, assuming you're otherwise stable and your fundal heights are normal, you're on your recovery bed, it's time to take you and the baby and your significant other and head back to the recovery area. You've made it. Now you're probably wondering, Dr. Bobby, what on earth are you going to do for me for pain after this? Depending on where you are, sort of connotes as to what they will do for your pain afterwards. In some hospitals, we use an epidural pump to deliver medication that makes you comfortable via that route. Otherwise, you can expect to get some anti-inflammatory medicines and some as needed narcotic medicines to control your pain. And just like that, you've made it through. You'll continue your post-op recovery, and once your sensation has gotten back to normal, you will go off to the mother-baby unit, and you will be happy, and I will be happy, and we all will be happy. You're a new mom, and you conquered the fear of a C-section. Listen, thanks so much for tuning into this video, and I hope you found it to be as informative as it was fun for me to make. Now, go down into the comments. I want to know about your C-section experience. Was it a pretty decent experience? Was it kind of terrible? Listen, we can't fix these things if we don't know them. So let's have a conversation in the comments. If you like what you hear and you've enjoyed our content, please feel free to like, share, and subscribe to the video. Otherwise, I gotta go. I'll catch you on the next video. Peace.